Have questions, they've got answers. Who's up first? Raise your hand.
Talking about symptoms and how symptoms present, one of the things that maybe was just touched on briefly was balance, and how when does Parkinson's, or how does Parkinson's affect balance?
So, certainly balance issues are very common in Parkinson's and certainly in many of the mimics. Generally, balance issues tend to be milder early on in Parkinson's and tend to worsen gradually as the disease progresses. They tend not to be as disabling until much later in the course. That can actually be a useful way of potentially teasing out Parkinson's disease from some of the mimic conditions like PSP or cortical basal degeneration or MSA or Lewy body. A lot of the mimics tend to have balance problems much earlier. Sometimes those balance problems are actually the thing that brings patients to the neurologists or their doctor's attention, saying, I'm falling left and right, or, a year or two ago I was fine and now I'm falling on a regular basis. That would clue us into that it would be much more likely one of the mimics, particularly PSP, but some of the others as well, as opposed to Parkinson's disease, where you may notice some balance problems, but usually frequent falls tend not to be an early presentation of it. It tends to be later on in the course when it becomes more limiting like that.
Yeah, that's pretty.
As far as Botox, are you finding that it's an issue with Medicare covering the treatments, or is it generally approved?
Yeah, actually, it is generally approved. It's not in these indications. I think if you're treating for dystonia, for this we call sialorrhea, salivation issues, and what was the third thing? Blepharospasm. Those are indications. Those are FDA approved indications for botulinum toxin. So Medicare blanket approves it. It's actually nicer in the case of Medicare. There's no prior authorization. As long as they have the correct diagnosis, it's approved. And so it sort of depends on your ancillary insurance and things like that. We always go through a process of validating the insurance beforehand so that patients aren't surprised by anything. Because the toxin itself, the actual compounds, are not inexpensive. And so, but I have not found that finances to be a big limitation.
My husband has a DBS about four years, which eliminated his left side tremor. Now he has a right side tremor. They decided that he was not a candidate for focused ultrasound because he has the existing DBS box. So that doesn't leave him with many options. He has moderate cognitive impairment now. He's a young 72, and so opening up his brain is perhaps not the best option. We have a panel discussion with the Dr. Elias back at UVA coming up next month. I don't know what other options, except they were talking about sticking a wire down, not me, but sticking a wire down and stimulating a certain part of the brain that may affect the right tremor, which popped up, later. Are there any other options besides maybe this external wire and a little tiny hole that could be considered?
Yeah, so DBS, deep brain stimulation for Parkinson's disease, putting a little electrode deep in the brain that basically is like electric cinemet in a sense, and can be very effective at controlling Parkinson's symptoms, particularly tremor. And considerations for that we have existing ones. Deep brain stimulation, sometimes they can make other adjustments that are less invasive or less potentially significant in someone who has cognitive problems, specifically if they're trying to make tremor better. Sometimes medications can be retried or adjusted. Yeah, I was going to say, you've probably been through the ringer for that.
Different cocktails for the last
Sure,
6 months, all have failed.
I will say, I'll put in a plug that VCU is looking at one study about potential a wearable vibrating device to see if that can quiet down hand tremor, and that's something that patient to patient whether they qualify for. But again, looking at our website or talking with Dr. Cloud at some point today about that study could be a non-medication option if someone qualified for it. Could be another
wearable
consideration.
Vibrating
Yeah,
device?
it's one of the studies one of a number of studies that we'll be starting up that may be a consideration. Again, you'll need to talk to Dr. Cloud about the specifics there, but we're looking at patients who have a bothersome tremor that the other options may not have been as useful for.
So the issue here is that that one side's been treated effectively with DBS, and
And it would interfere with an open brain surgery
With
with
the
the focused ultrasound.
right. Yeah, and so there are a limit to the non-pharmacologic, so surgical options. But the only thing I would say is that one option that I'm not sure there would be contraindicated necessarily would be Gamma Knife. So Gamma Knife is a tool that exists already. Gamma Knife, and I'm specifically talking about treating just the symptom of tremor. So DBS is complicated, and there are multiple targets, and depending on the target, you're going to get an effect on different symptoms, and you know that. But for the audience, and so the target in the brain that just treats the symptom of tremor is a little bit more forgiving from the standpoint of cognitive issues, and potentially could be targeted with Gamma Knife, and you could see a reduction in tremor symptoms.
And
Yeah,
the
and
idea is, it's focused ultrasound, Gamma Knife, both ways of burning very small holes in the brain to quiet down tremor. Gamma Knife uses radiation, focused ultrasound uses ultrasound waves. I will also mention, and it's occupational therapy can sometimes be a benefit as well. Again, I like non-medication options wherever possible, and that may be of some benefit. It tends to be more in benefit in people who have tremor with action sometimes than tremor at rest, but they may have some strategies, they may have some tools or technologies that may be helpful in some patients. So if you already are seeing occupational therapy or periodically see them, sometimes they can have some additional thoughts as well that may help just day-to-day stuff or workarounds or things like that. Again, may not be as useful for rest tremor, but it's another avenue to explore that doesn't involve surgery and things like that.
And like any therapy, you really have to weigh the impact the tremor's having on functionality and quality of life, and weigh that against the risks of the procedure. So, that's part of the counseling.
Do we have any PSP-related questions for the panel?
My husband has MSA, and he's been treated with Botox in his cheek. But can you do the, Botox here and around the eyes as well?
Yep.
I mean, it's not like overkill.
Nope.
Okay.
I have plenty of patients that do that too.
And Medicare has paid for it.
Yep.
He has a supplemental
Yep.
plan, but
Yep.
no questions.
Yeah, we do the sialorrhea, we do the blepharospasm. Like I said, a lot of
Okay.
PSP patients may have both of those problems, so we treat
At
it.
the same time.
Yeah, and also sometimes, the other indications like dystonia, I have some patients where I'll inject for, neck dystonia, and while we're there, we'll also inject for sialorrhea, for drooling, and so you can do it at the same time. In fact, it makes it easier because that way you're getting it all done in one fell swoop, and then you don't have to see that injector again for 3 whole months, and you get to, kick back
But
and
does
relax.
Botox in the neck affect swallowing?
It is a theoretical risk that it could
Yeah.
affect swallowing, although we're all trained to sort of target the muscles in a manner that really minimizes that potential.
And so that warning, but the warning about the
course.
potential spread of toxin shows up in any Botox that you use. It's just a standard labeling. So even for folks who get Botox for urinary incontinence, where the Botox is actually injected into the bladder, the same warnings are all on every Botox box. So not to minimize them, but certainly they're just kind
Right,
of
in other words, the
standard.
risks are specific to where you're injecting, but the pamphlet just says everything.
Yeah.
So you're not going to have bladder weakness from injecting your islets, but it's in there.
Yeah, you'll see it all. Yeah.
Yeah, if you
Someone did something wrong there.
miss the site.
My question
question is, and I think Dr. Snyder, you already answered it. If you did for the 2 reasons for the Botox, for all of them, you would have to come back in 3 months, no matter which reason you use the Botox.
Generally,
Right.
yeah. So Botox is administered every 3 months, pretty much regardless of the indication, for a few different reasons. One, that's how often insurance will pay for it. 2, that's how long it should generally last. Sometimes with some things like blepharospasm, sometimes if you've been on it for a while, it may last a little bit longer per dose than 3 months, but usually about 3 months. And if you do it too often, if you were to inject it too often, there's a theoretical risk that your body can get immune to it. And probably a lower risk nowadays, but that's the various reasons that we space it out to be roughly every 3 months in between injections. So.
And I had one other question, the pharmacist, I can't remember your name. You had mentioned that there was a list for alternatives. Where can we get that?
So I can pull it and send it to Bobby or Jacqueline. There's lists. The American Parkinson's Disease Foundation, I believe, has one, and then the National Parkinson Foundation definitely has one. If you go through the Aware and Care Kit, if you go to awareandcarekit.org, I think the website is, they'll actually have. You don't actually have to get the Aware and Care Kit to get all of the goodies that are inside of it. And so one of those pieces that they'll have on there is like a list of drugs to avoid and a list of safer alternatives. The only thing that I'll warn you about is that it's been a couple of years since that's been updated, and so it's part of the reason that I don't print it. So there's stuff that's been taken off the market since, like propoxyphene you can no longer get, and that's listed on there. So not a crisis, but just kind of one of those things where it's a little out of date.
Is that kit free?
Oh yeah, the
patients,
kit
yeah.
is totally free. Yep, and so are all of the. But like if you're waiting for the kit, sometimes it can take a couple weeks or even a couple months. So if you need the information before then, you can go online and print it all from their website, and that's free. So you can just download it or print it. But yeah, so I can either send you a list or, like I said, APDA, and definitely the National Parkinson's Foundation has one. But like I said, most of those are a couple years out of date. Probably good motivation for us to update it and send them RX.